Hello! So you just had your tooth extracted and you need some post-op instructions. Everything today that we discussed will be on your take-home sheet that you can review. Now, let's go ahead and start with the obvious. You're gonna be numb for a while. Be careful when eating or drinking. We just don't want you chewing on your cheek or your tongue thinking it's some food. The second thing we're gonna talk about is the wound itself. Now, it's very normal this first day to have some bleeding. What we would like you to do is to bite down on some gauze that was provided at the office for at least 30 to 45 minutes. Afterwards, you can take it out and take it out slowly. We just don't want you to pull out the blood clot. Now, for the first 24 hours, some slight oozing is very normal. If you ever feel like the wound has opened again and is starting to bleed a little bit more than normal, what we would like you to do is re-bite down on some gauze. If you do not have some gauze, a wash rag will suffice. The next thing we're going to talk about is some swelling. Some swelling in the area and redness, very, very, very normal. If you had stitches placed in, those stitches can come out within the next day or so, or even in a week. Very normal. The stitches are there to just get the wound started and hold any packing material or medicine we might have placed where the tooth was pulled. Speaking of which, as the wound begins to heal, a scab will begin to form over it. That will look very different than the scab that would be on your arm. The scabs in the mouth can look a whitish color, not necessarily an infection. So after that, it will take about 6 months for that wound to completely heal as if there was never a tooth there. So in the meantime, getting food stuck in that wound happens often. We recommend just irrigating or rinsing with salt water. Next up, we're going to talk about some post-operative pain. You did have a minor dental surgical procedure completed. Some pain is very normal. As a matter of fact, pain can last up to a couple weeks, even a month. Some patients leave with very minimal discomfort, others can have a little bit more. Please see the pain indicated form that we have given for you and take any pain medication as we've described. So then let's talk about diet. Diet your first couple days, we would like soft, cold foods. Nothing super warm, super crunchy, or spicy. You want to give the wound a chance to heal. If you get food in there, it can be very discomforting. If you do get food caught in there and you feel like you can't clean it out by rinsing out with some water, please see us immediately. Now we're going to talk about smoking. Smoking puts you at a high risk of what's called a dry socket. A dry socket is when the body discontinues healing where you had your tooth pulled and is extremely painful. If you feel like you have a dry socket, contact us immediately. For smokers, please avoid smoking as long as possible to give your body the best chance to close up over the wound before any smoke gets in there. The smoke will irritate the wound and cause a lot of discomfort. Brushing. You can brush immediately, just avoid the area. Brushing the area can cause the scab or the blood clot to become loose and cause bleeding again, or even some discomfort. Finally, let's talk about activity. For the first day, we want you to take it easy. No long exercises such as lifting weights or even some running. We want you to take it easy today. As a matter of fact, when you go home and you sleep tonight, sleep with your head above your chest. That way all the blood's not rushing to your head. Finally, if you have any questions, feel free to contact myself or the office and anybody will be happy to help you. Thanks.